Preclinical studies demonstrate that when you combine CD4/6 inhibitors to PD-1 inhibitors, that it can upregulate the immune response. So specifically, it can make things more immunogenic, it can increase anti-tumor response, and then potentially increase the duration of response to immunotherapy. So this is why we performed a phase 1b clinical trial here at City of Hope, in which we combined a CD4/6 inhibitor called Palbociclib with an immune checkpoint inhibitor, Pembrolizumab, in combination with endocrine therapy in hormone receptor-positive, HER2 negative metastatic breast cancer. So that's the basis of the underlying study, and we're very excited about our results. We had 3 different cohorts of our phase 1/2 clinical trial. Cohort 1 was looking at patients who are already on palbociclib and endocrine therapy, and then adding in pembrolizumab after having stable disease for at least 6 months. Unfortunately, that cohort was a bit slow to accrue, so then we opened a second cohort looking at the 3 different drugs, palbociclib, endocrine therapy, and pembrolizumab, getting all those 3 agents at the same time on cycle 1, day 1, in first-line metastatic breast cancer. That initial cohort then showed some really great responses, and so then we opened cohort 3 to look at pembrolizumab given on day 1, and then palbociclib given as a lead-in, so on day -28 with endocrine therapy, to further evaluate the immune potentiating effects of giving a CD4/6 inhibitor prior to immunotherapy. So we looked at baseline stool analyses and then correlated these according to the response that we saw on the trial. And we looked at both best response according to whether patients had a complete response, partial response, stable disease, or progressive disease. And we actually found several gut bacteria that were more abundant in patients who had a better response to the IO combination. These bacteria actually were significant in other clinical trials that looked at other types of cancers and were shown to be in greater abundance in those tumor types. These are bacteria in the genus Lachnospira, as well as Faecalibacterium, as well as Allostepes. And so we really think that these 3 bugs are maybe driving the responses to immunotherapy and need to be further evaluated in other prospective trials. The trial showed that the grade 3/4 adverse events to the combination were mainly cytopenias as well as liver abnormalities. So about 80% of patients actually did experience a grade 3/4 neutropenia, and about 50% of patients experienced a grade 3/4 leukopenia. And then the liver toxicity, patients had about 15% of them had grade 3 or 4 liver toxicity. So the combination, having cytopenias, you can dose reduce the palbociclib, so it's definitely something that we can manage. The liver toxicity, which was a little bit more rare, can also be managed with steroids, but tweaking the regimen a bit to dose reduce is definitely possible. The follow-up time currently of our trial is about 4.5 years for cohort 1, 5.5 years for cohort 2, and about 2.5 years for cohort 3, since they all opened up at different times. And actually, survival outcomes for cohort 1 and 3 have not been reached yet. So a lot of these patients are still on study, and we're seeing amazing responses that are lasting a while. And so it really shows that this combination of therapy could be big in the future. Right now, we do have PFS. So PFS for cohort 1 and cohort 3 are also not reached since patients are still on trial. Cohort 2 has read out, and that was found to be 27 months, which is similar to the other studies that we're seeing with palbociclib and other CD4/6 inhibitors.